would you do that with this? Now, Eli, briefly, there was some work done out of Israel that you have spoken about. Educate our listeners briefly on, because this is really important and really is enlightening. Educate our listeners on this, because the bought off lame screen fake media will never touch this.
No. And in fact, Israel, I think, is trying to shut this up now. Well, Israel is an interesting test case for this because they really are a kind of a uniform population. They're a small enough country, 8.8 million people, and they're trying to really press everybody to be vaccinated. I mean, right now, I think they're over 50% of their population is vaccinated. But the time this happened, what we're going to talk about, 12.5% of the people were vaccinated. Now, the government came out with the data. They wanted to convince everybody to take the vaccine. So at that point, they were transparent, and they let all the data out, and they said, see, it's 95% effective. But independent analysis was done by Dr. Seligman, he's a biologist in Marseille University in the Department of Epidemiology and Infectious Disease, so no lightweight. Right. His partner in this is an engineer, and the engineer, Mr. Yativ, I'm sure he's mathematically competent. So that's what, and I looked at their actual original paper and their data, and I think I trust what they say. They said, wait a minute, we're not being paid by the government, we're not being paid by big pharma, and so our only claim to any conflict of interest is we have children that live in Israel and we don't want anything bad to happen to them. Right. So we've looked at these numbers that the government says is doing good, but we see that it's doing bad. And here's what they showed. They showed that at the time that 12.5% of the population had been injected with these things, and it was all Pfizer, by the way, at the time. So that is also helpful. You know, you're not mixing what you're giving. One thing, 51% of the deaths from COVID, the disease we're trying to vaccinate you against, right? 51% of COVID deaths were now in people who had been vaccinated recently. So what's going on? If it's even, if it doesn't make a difference, then it should be 12.5% in both groups. Right. And when they broke it down by age, they showed that if you're over 65, your risk of dying of COVID goes up 40 times if you take the vaccine. And if you're under the age of 39, it goes up 260 times. Now, even beyond that, there's another Israeli researcher that looked at some of this stuff, and he points this out. He said, they felt bad for the Palestinians in Gaza, which is the most, densely packed area in the world. If you have social distanced in the Gaza, you'd be out in the Red Sea. You can't do it. So right. They didn't, and they didn't mask it, they didn't do anything. And the Palestinians didn't get the vaccine, but the Israelis did. Now, what was happening is before all this, there were, the death curve, the nice bell-shaped curve was showing that the death from this was going down. It was very, very low in both groups. In the Palestinians, it's still going down and very low, almost to zero. But in the Israelis now, it's going back up during this vaccination period. Another fact is that within Israel itself, there are two internal groups, the Orthodox Jews and the Arabs within Israel. Both of those groups denied this whole idea of social distancing. They didn't wear masks. They grouped together in their religious services. They partied. They didn't listen to the rest of the country. And they had a certain death curve. But what happened after that is the Orthodox Jews decided to get the vaccine and the Arabs did not. The Arabs are doing fine. The Orthodox Jews are now getting death from COVID. This is too much data to just ignore. It's not one data point. Everybody wants to say, oh, that's just anecdote because you're just telling one story. This is a whole nation. And again, people can look at this. This is open source. They can find that paper online. Unlike many of the things, I think one of the more humorous, it would be humorous if it weren't so tragic, by the way. One of the most humorous kind of things in this whole deal is trying to silence us from using and keeping us from knowing about hydroxychloroquine. They made a fake database. And one of then it was called Surgisphere. And I don't know, you've probably heard the story, but they had these two papers they published and they had to retract them.
Right, out of Lancet.
Out of Lancet and out of the New England Journal of Medicine. And Surgisphere, I don't know if you knew who ran, but that would turn to be one of these shell companies, these storefront fake. It doesn't even have a database.
It was a fraud.
Yeah, and it was run by, this is the funny part, it was run by it's not a science writer, but a science fiction writer and what they called an adult content model, i.e. a porn star. I mean, that was their data collection situation there. They had no data, but they were convinced it didn't work. This is the level of corruption going on about this.
Lee, in our concluding minutes here, because I know you got another thing to. I want to hit a couple quick points in your take. First of all, for those that say I want to prevent getting COVID, what's the best preventive protocol Dr. Lee Merritt can come up with. Let's do that. Let's do early treatment if you do develop symptoms, and then let's talk about the people that have already been vaccinated. What can they do to help themselves? So first of all, a preventive protocol.
Well, part of this is what we should all be doing. In fact, most of it's what we should all be doing, because this thing, one of the ways it kills you is it's an inflammatory overshoot, right? So live an anti-inflammatory lifestyle. By that I mean, and this is what I do. I don't eat wheat, barley. I'm on a gluten-free diet, because it turns out that those foods cause inflammation in the body and in the brain and all sorts of things. That may pop up as Alzheimer's, but you don't know what's going to happen. You may not think it's hurting you, but it's bad. Second thing is, and there's some very good books about all this I'm talking about, but there's, eat natural occurring oils. Do not eat man-made oils. Those two push inflammation. Man-made oils being things like soybean oil, corn oil, canola oil, the things they told us were healthy, right? It turns out everything they told us has been wrong. Anyway, so don't eat that. And then don't believe them when they say vitamins just make expensive urine. They know better. That's just a lie also. So the biggest actor on the block is take vitamin D, and you cannot get it from the sun. Nope. I was in Yuma, Arizona as a spine surgeon. I had patients that played golf 18 holes, 6 days a week. Their levels were in the toilet, like 20. Don't think you can do it from the sun, no matter how much you may be out. So take it. I take 10,000 international units a day. I don't think nobody's ever overdosed at that. Orthopedics recommends at least 5. I will tell you 1,000 or 2,000 spitting in the wind. You won't get your levels up that way. So at least for adults, you have to go more. Now, children, by the way, we'll talk a minute just at the end about children, because they're really not the same risk. No. But that's the third thing is vitamin C throughout the day. It's better to take vitamin C is your ammunition for your white cell army that fights viruses. So you want to take a little bit all day long, not just 1,000 in the morning. Okay. And if you start getting sick, take a lot, take 500 every hour or two, just chew on it. You won't get diarrhea on 500 an hour or two. And then it gets into your system. I like the liposomal vitamin C. The other one is selenium is an unrecognized, it's kind of like I heard Dr. Buttar say it's birth control for viruses. And I think there's a lot of, and interestingly, the Chinese soils are very deficient in that. They had to put it in to prevent cardiac disease over there. The other one is zinc. It turns out, I told you about the Indonesian study, but 50% of people dead of COVID are deficient in zinc. And zinc has been leached out of our soils or something. So you need to take at least 15 milligrams, preferably 30 milligrams a day of zinc. What did I leave out? Oh, and the latest one is N-acetylcysteine.
Yes.
NAC. NAC is a huge intracellular anti-inflammatory. It's good for what ails you. It's an anti-cancer, anti-dementia. It does a lot of good things, but it works by producing a chemical in your cells that really is anti-inflammatory, and it's in your brain. It goes everywhere. So that's a good one, 600 to 1,000 milligrams.
What about quercetin?
Yeah, and quercetin. That's the last one. Quercetin, and I don't know as much about that. I know Dr. McCullough and Dr. Zelenko and Tyson, those guys, it's 500 milligrams a day or twice a day. Again, these things are cheap. And I will just make the editorial comment, this is to my fellow physicians that aren't doing this. We are treating our elderly abysmally. This is right out of Germany. This is terrible. We are, people that we're treating like they're not worthy of living. 40% of the deaths in America were due to nursing home deaths. We could have, we've put them in isolation and solitary confinement, cruel and unusual. We feed them a terrible diet. We don't supplement with what we just told about. And for 2 hydroxychloroquine tablets a week, you could prophylax them and they wouldn't be dying like this. So if you cared, that's what we should be doing. And you can look that, that's what they have, that prophylaxis. They use it in India. People should wake up to the fact, by the way, if they don't think it works, that India, 1.2 billion people, lots less deaths than we do because they use it prophylactically. Our death rate, the worst in the world, was in New York, 0.17% death per capita. The best, Uganda. We think of that as like this dictatorial hellhole. No, it's freer than we are. You can walk down the street in Uganda and buy hydroxychloroquine and these things over the counter, and guess what? Their death rate is 0.00003%, 10,000 times better than New York State last year.
Second issue, early treatment. Folks starting to get symptoms, what do they do?
Early treatment. So it'd be nice to, before you get sick, to realize this isn't just about COVID, and it isn't just about this COVID.
That's right.
That even though that this one wasn't so deadly, this was maybe a Hail Mary pass by people that really want to take us down, and they have worse things in their freezer. So they've got other viruses. It's just a matter of letting them loose. So, first of all, when it's time to go to your basement when doctors and nurses are dying. If we can't save ourselves, then
right.
It's time to go to the basement until we figure it out. Wearing a mask does not work. Don't get a false sense of security. Only thing, like smallpox, if you read Demon in the Freezer or any of these books about smallpox, the only thing that can save you from a disease like that is total air isolation.